This week, artificial intelligence has now formally decided to step deeper into one of the most sensitive and private parts of our lives, which is healthcare. So, OpenAI has launched ChatGPT Health, which is a version of ChatGPT that is specifically designed to answer medical questions. And ChatGPT Healthcare, which is a separate offering, is for medical and healthcare professionals to help them with personal health data like test results and wellness records. And also, after this happened, Anthropic announced Claude for healthcare. And Anthropic is specifically positioning Claude as a tool for hospitals, insurers, patients, really focusing on more of the admin side of clinical workflows, documentation, and patient understanding.
Yeah. And you know what I found really striking about all of this is how carefully both Anthropic and OpenAI are kind of framing these products, the
Right.
way they're
Yeah, yeah.
talking about it.
Hmm.
They're saying that these are tools meant to support doctors and patients and
Yeah.
not replace healthcare. They're repeatedly saying this in all kinds of messaging, like blog posts,
Yeah.
advertising. They're saying it's basically to help people make sense of medical information,
Right.
reduce paperwork, like you said, and overall just improve healthcare systems function.
Hmm.
But they're also describing these products because, of course, they understand that health data is very sensitive, right? So
Yeah.
they're also talking about privacy and security and, human oversight. So, yeah, that's very interesting, actually, the way they are framing all of this.
Yeah, I mean, so it's important that they cover their bases, right, because of the nature of this data.
Yeah.
But I think it this was something that was going to happen because it really reflects something that's been happening for a while now, right? Since
Yeah.
ChatGPT has been launched, and even before ChatGPT, when we used to Google like random symptoms to see what the
Yeah.
underlying problem could
Yeah,
be.
and then Google would tell you, "Oh my God, you're going to die now."
Yeah, every
Yeah.
headache, stomach ache, everything is cancer. So now millions of people around the world, and especially in India, because we have a huge healthcare system with a lot of gaps, we have
Mm,
been using AI chatbots to ask health questions, understand symptoms, or even prepare for doctor visits. So you know exactly what to ask them, and you don't waste time. But of course, because again, we keep coming here back to this, healthcare is very sensitive.
mm,
This behavior has existed in a gray area, but
yeah,
with these launches now, major AI companies like Anthropic and OpenAI are making all of this very formal and signaling that this use case is, kind of here to stay and it's only going to grow.
exactly. Yeah. And also in some ways it raises very important questions, right?
Hmm.
Particularly in the India context, because we know how exactly our healthcare system falls short.
Yeah.
Uneven access, language issues, shortages, like remember COVID,
Hmm. Right.
huge, also like crazy differences between public and private healthcare. And
Yeah.
now with AI in the picture, like all of this whole system is going to get affected in some very, very complicated ways, I would say, right?
Yeah. And because this is quite nascent, I mean, there's still a lot left to see. Like, a lot of this is still going to play out. Like,
Hmm.
it's difficult to predict what exactly would happen. But today, we just wanted to take a step back and ask, as AI is becoming more present in healthcare, what does that mean for India? And where might it genuinely be useful, especially since we discussed there are a lot of gaps in the healthcare system, but also where do the risks show up, and how should patients, doctors, and policymakers think about this before these moments become routine and ingrained in our life.
All right. So before we actually get into the discussion, I think it's worth pausing to understand why does this moment really matter so much? Because AI in healthcare is is kind of creating both opportunity and also a lot of complexity, like we mentioned earlier, right? Um, for example, in India, we know we have some really big gaps in our healthcare system. Look at access, look at the doctor patient ratio in our country. It's terrible.
Hmm,
It's like,
exactly.
oh, we have what, one doctor for more than 800 patients.
Wow.
Um, and there's also the issue of medical language. And I think
Right.
we see this, every time you go to a hospital, I think you can see this. so many people struggle to understand basic medical information, right? Make sense of diagnosis, make sense of reports,
Yeah.
right? So I think yeah, these are the reasons why, I think this discussion is very important.
Yeah, true. I mean, even I don't think I can really look at medical reports and understand what's happening. I always have to call like a doctor I know or a family member to discuss and understand what's happening. But still, on the other hand, healthcare is very much an area where error and bias and lapses in privacy or misplaced trust can have very serious consequences.
Yeah.
So, we wanted to look at a few specific claims that are being made around these AI healthcare launches. We'll talk about privacy, about bias that exists in medical data, and about whether AI can actually realistically support doctors, and about who benefits first when these tools roll out.
Yeah. Basically, we are not here to give you a verdict on, whether AI in healthcare is good or bad. We just want to understand what's really at stake here, right? I'll just start by saying that generally, I feel like this is a step in the right direction. Um, and it's because what Rachel mentioned earlier, right? People have already been using ChatGPT and other AI tools for medical advice, whether these companies like OpenAI and Anthropic were endorsing it or not, right? The difference
Yeah.
now is that both of them are openly acknowledging this use case, and they are building these specific healthcare focused products, and they are telling you about the limits, they're telling you about the guardrails, about what kind of expectations you should have, you know. And I think this creates very clear lines of responsibility, because
Hmm.
once a company publicly positions its product for healthcare, I think it is going to become easier for regulators, for governments, journalists, even doctors, and also users to kind of look at their claims and also demand safety
Safety
standards,
stuff.
right?
Yeah.
So I think it's going to be now easier for us to hold these companies accountable for harm, because now it's a formal product and there will be some kind of traceability.
So I agree for the most part that I think
Hmm.
it's best to formalize it and make sure that you're building a product that now has involved other healthcare professionals. I think they have about 260 doctors and medical professionals help build their data
Right.
set and stuff.
Hmm.
But I think even though it is a more formalized thing right now, there's still no like federal regulatory body that's actually overseeing this kind of information, right? Like
The
what's being
US.
uploaded to
Hmm.
AI chatbots. Yeah,
Hmm.
I mean, it is available only in
In the
just
US.
select parts in the US right now, but there is a wait list in India,
Hmm.
from what I know. So,
Hmm.
but OpenAI tells us that it's worked with, healthcare and medical professionals to provide this platform, but who's really like checking or holding them accountable at this stage? You know, to make sure that the quality of the data is up to mark
Hmm.
and like whatever responses that come for each prompt is
Hmm.
accurate, right? There's no real time checking that's being done. And
Hmm.
I mean, we've seen a lot of cases when in terms of mental health and like people who go to AI chatbots in case of mental health scenarios, and those have had some adverse circumstances, and those lawsuits are still going on, so it hasn't entirely been held accountable so far. Like it's still, like we still have to see what comes out of it. And honestly, though, 260 medical professionals I think is not a lot when this is a data set for a product that's being used by millions of people across the world. And
Yeah, but I think they also said these 260 medical professionals were from very diverse places, like
yeah,
from many different countries. They selected not just one or two countries, I think.
yeah, I mean, I hope it is like a well-rounded, fleshed out product, but it still has other risks, like healthcare information is incredibly private and sensitive, and
Mm.
even though there haven't been any major leakages of prompts or any sort of interaction with OpenAI en masse. But again, there is no regulatory oversight here. So every individual user is entering into a very private contact with OpenAI. So any data
Yeah.
breach or lapse in information is on your discretion of use and not really on the service itself. But a patient doctor relationship, on the other hand, comes inbuilt with confidentiality and accountability. We know exactly who to go to and who
Yeah.
to hold accountable if there is any sort of lapse. But how will someone take responsibility for an accidental breach in privacy with the service? And I think my biggest problem is that it still feels like a waiting game. We are waiting for things to go wrong and then hold them accountable and then they fix
Yeah.
it. But then, what about all the possible like misdiagnosis and inaccurate information that happens along the way? And will
Yeah.
that all just be collateral damage?
Yeah, no, I agree with you on most of this, very fair. But again, coming back to what both of these companies are very clearly saying, everywhere, that these products are meant to support healthcare systems, not replace them. Like Claude, for example, right? It specifically says that it will show contextual disclaimers, it will acknowledge uncertainty, and it will also direct people who are using it to healthcare professionals, to doctors for
Hmm.
proper guidance. And
Right.
also another thing that really strikes me, especially in our country, is how people just don't have the privilege or the education, like I said earlier, to
Hmm.
understand medical language, right? Every
Hmm.
public hospital you go to, you see doctors are stretched beyond their limits. They just don't have the time or the patience to sit and explain the
Yeah.
diagnosis or the treatment to their patients. You'll just hear them barking instructions a lot of the times.
Hmm.
And even, for example, when you get a test result, it's very hard to understand what does it exactly mean. I
Yeah.
remember going to AIMS for my mother's
Hmm.
treatment many
Right.
times,
Right. Yeah.
and there's so many people, Rachel. Like, you see, they're not
Hmm.
from the cities. It must have been very hard for them to get to AIMS, to
Hmm.
get their family members treated, and the way they are interacting with the doctors, or the way the doctors are interacting with them. Again, like,
Hmm.
you can see they're blank, when the doctor's talking
Yeah.
to them, they have no idea what they're saying. And even, very simple example, medicines, right? We
Mm-hmm.
know for a fact that so many doctors, they just prescribe medicines to patients because they're getting paid by pharma companies. This is a very common thing
Right.
in India, right?
Yeah.
uh, Also, not everybody has a doctor in the family to go back to and
Yeah.
ask these
True.
questions, right?
Yeah.
So I really think in these kind of cases, these tools can be very helpful to make sense of what's going on.
Yeah. I agree with that for sure. Like medical language is not easy for everybody to understand. And like I mentioned before, even I need help. So I can only imagine people who are even less comfortable with this are struggle a lot more. So, but I still feel like the problem becomes that when the narrative is that you can use ChatGPT when you don't have access to a professional healthcare provider, then it becomes a stopgap solution, right? You
Yeah.
still have to maintain a sense of discernment to know that, okay, this is something that I can use ChatGPT for, this is possibly not, and this is where I need to get in touch with a professional and get like a second opinion. But
Yeah, but can I just
hmm,
cut you there, because you're saying, yeah, you still have to maintain a sense of discernment, and I think that's not too much to expect
hmm,
from a user of the internet in general. Like, with the
yeah,
way the internet is, I
hmm,
think some sense of discernment is required. It's good to hone,
yeah.
you know. So yeah, there's also that. Anyway, sorry. Yeah.
No, that makes sense. But I'm just thinking if you use ChatGPT first and then you something doesn't seem right and then you still have to contact a healthcare professional, then why
Mm.
wouldn't you just do that in the first place? Like I don't think it's really solving a problem of access there. And of course, there are some studies that show that LLMs specifically are more likely to lean towards being helpful instead of medically accurate. Like these bots are trained to make you feel good about yourself.
Hmm.
And they are actually even try to generate answers that you as a user are likely to respond to, so that you keep talking to them and keep staying on
Yeah.
that platform. So
Hmm.
if a chatbot's agenda is inherently to keep you in like this discussion loop and it's not entirely incentivized to be accurate, then I think you're bound to end up with information that might be a false positive or just straight up inaccurate. Like, for example, I think last week some Google AI overviews had to be taken down because it was giving up straight up wrong and dangerous information.
Mm.
Like it was saying that people with pancreatic cancer have to avoid high fat food, but the actual advice is the exact opposite. And the recommendation is that avoiding high fat food could increase the risk of patients dying from the disease. So, of course, there are a lot of cracks in this because it's a new technology. But I'm just concerned that these cracks will only be like filled up after several people have already fallen through it.
Yeah, true. But again, another area, I think we mentioned this also before, like just reducing paperwork, right? I think that
Hmm.
that space it's going to be really beneficial
Mm-hmm.
because we know hospitals in India, for example, are just drowning in paperwork. Patient records are
Yeah,
like
true.
all over the place. Their handwritten notes, and doctors actually, especially in public hospitals, right? Because record
Mm-hmm.
keeping is so important there. uh so much time is just going in just
Yeah,
documenting instead of treating, right?
true.
So yeah, in these cases, AI could just structure these notes. They could help with discharge summaries, follow
Yeah.
up, and this would actually help free up a lot of the doctor's time. And I think also another thing that I realized when my mother was undergoing treatment, continuity is so important because we were going
Right,
from one
right.
hospital to another, and this is
Hmm.
like we're talking about a span of years, right?
Mm-hmm.
So it's very important for the doctor to know exactly what happened in the past, what kind of treatment did you
Hmm.
undergo, what kind of surgery,
True.
exactly what medicines you were taking. And this is
Yeah,
years of information, and continuity is very important, right, in such
yeah.
cases. So even there, I feel like AI could be very helpful. Another thing is also insurance, can help organize better,
Mm-hmm.
reduce claim rejections, that way help patients.
Hmm.
Yeah, so I think like, in this regard, AI in healthcare may not be so bad. Smoother data management, less paperwork across the system could really do us a favor.
Yeah, I think this is definitely an area where it is helpful because admin work, as much as stress can be reduced in admin work, I think the better for any sort of healthcare organization. But I would still like to point out a few things. Whereas, since you mentioned that continuity is so important,
Yeah.
some studies have actually shown that LLMs tend to hallucinate or produce inaccurate information
Hmm.
when there is incomplete data that is provided to the um, model
To the
itself.
system. Yeah, yeah.
So I think over here, there's like a huge responsibility on the staff that is using this LLM to make sure that whatever information is going on it is very accurate, and whatever information is coming out of it, whether it's arranged or um, put together or whatever, is
Hmm.
also accurate and not there
Hmm.
aren't any errors or consequences. Because like you mentioned, if it's something that could help on the insurance side, if somebody were to lose their insurance or lose out on their premiums or something like that, then
Yeah,
that's a huge problem. And
true,
again, a lot of people in India who can't afford to uh, recover from those kind of mistakes.
true.
And and in these situations, do you hold the AI accountable, do you hold the staff accountable? There's very
Yeah.
little clarity on that, but overall I think it could be a good thing.
Right. Actually, speaking about data, I think one thing that could be a huge risk is data bias, right?
Right, yeah.
Because we know how modern medicine is already biased, right? Like
Yeah.
all the clinical trials, not all, at least most of them, so much of medical research is has been historically focused on the western white male population, right?
Hmm.
And this obviously shapes how disease are being treated, how they're understood. And AI is kind of learning from the same sort of medical literature and health data, right? So it's not really, actually these gaps are not going to get filled, it's going to just reinforce these gaps, right? And
Hmm.
in a country like ours, this is very worrying because our
Hmm.
population is very much younger. We are more diverse. We are genetically very different from each other. We're
Hmm.
exposed to I don't know, all kinds of different nutritional conditions that shapes our
Yeah,
bodies. You know, disease
exactly.
work differently, you know,
Mm-hmm.
medicines work differently on us. So if an AI's default reference point is Western data, then yeah, then this is a huge problem. And then add to this all the gender bias also,
Mm-hmm.
right? Where
Exactly.
women's pain is under recognized, it's not acknowledged
Mm-hmm.
as much as the man's is, right? And also, what about the poorer, rural, marginalized communities, right? They are barely documented at all, even now. So, if that data doesn't even exist, those populations are basically going to disappear from the AI's perspective, right?
Yeah, that's true. That is actually a really huge, concern. But I think an alternative for that is like really deep research into rural area, building smaller data sets that are very locally based and
Mhm.
for very local use based on the languages that are spoken in that area.
Yeah.
And if it's not every culture, especially smaller rural areas, have a written culture, so to say. They have a more vocal talk based culture. So having voice chatbots and things like that,
Yeah.
those these are the kind of products that would really help, instead of like these mass consumer facing products that inherently come with a huge that
Yeah.
come with huge holes.
Yeah. I think there are already some AI companies who work in the healthcare space in
Yeah,
India who are doing this, right?
yeah,
Working with smaller, more rural, marginalized communities.
yeah.
Right. Um, so yeah, I think we're coming to the end of our discussion now, and clearly AI is already a part of how many of us think about our health. You know, it's the same thing, right? We check our symptoms, we read our reports, and we try to make sense of, all of this and
Hmm.
prepare for our doctor visits. And none of this is going to go away. But the concern is that yeah, these tools are going to reflect the systems that already exist,
Behind them,
and
yeah.
these systems are full of gaps and full of biases. And yeah, so these tools can help for sure, I think, but they should not replace judgment, and I think that's really on us.
So, if you're using AI for health advice, treat it like a second set of notes, not a second opinion. Use
Hmm.
it to understand, to ask better questions when you're finally in a room with a doctor, but know when to stop and see a professional.
Yeah,
Because in healthcare, convenience should not be the thing that becomes care.
true. And with that, this is the end of our episode. And I hope you guys liked it. If you have any thoughts on it, please do write to us. I'm sure you have a lot to say about AI in healthcare. Write to us at podcast@theken.com. And on the subject line, you can say Daybreak Fridays. And we will get back to you. Looking forward to hearing from you. And that's a wrap.